My name is Dr. Deepa Elizabeth Mathew. I am one of the senior pediatric consultants at Apollo Hospital, Vanagram. I am a pediatrician and have also specialized in neurodevelopmental pediatrics, and I did most of my pediatric training in United Kingdom. Today's topic would be on Attention Deficit Hyperactivity Disorder, which is also called as ADHD. Now, this is a common neurodevelopmental condition seen in school-going children. It's seen between 3 to 10 children per 100 children. So in a classroom of 50 children, you would see around 3 to 5 children with this condition. The main problem with this condition is children lack attention, they have poor concentration, they are quite hyperactive, they don't sit still, and also they are very impulsive. Now, this would hamper their educational progress at school and also have a big impact in the social life they lead. How can we help these children? There are no definite lab test or brain imaging which would come and help us with the diagnosis. It basically depends on a thorough clinical history by a neurodevelopmental pediatrician and a thorough examination by them, and then they give you advice on how to manage the symptoms. The common symptoms with which the parents present is that the child doesn't focus and sit and do a work. They make silly mistakes at school. They tend to not finish the homework. They lose their stuff at school. They always are on the go, so they do things moving around. They wouldn't sit still in a place, and they're quite impulsive, so they don't wait for their turn. They interrupt the teachers or parents when they're talking with each other. Now, when this happens, the child is not able to progress at school, and they lag behind in their education. Now, what causes it? There is no definite reason for it. It seems to be genetic. Boys tend to have it more than girls, and also parents of these children generally have some symptoms as well. The research have shown that children have less dopamine activity in the brain. So this is ADHD. So how do we manage it? For parents, it's quite simple. If they follow a structured and routine lifestyle, so if they have a proper structure to their life, the children might be able to cope with it. Cut down on sugary items, so generally avoid anything which has high sugar contents. Make sure you avoid food which have coloring agents. Make sure you give them food which is well balanced with iron and vitamins, especially omega-3 containing food like fish. Make sure that they have a proper sleep habit, that they go to bed on time and wake up on time. And it would be better that if you keep them reminders so that they remind themselves of what activities they need to do. And in a school's environment, make sure that they sit very close to the teacher and they get verbal and non-verbal warnings from teacher when they see that they're restless. So these will be useful when it is a mild case. But in severe cases, when the child is not able to progress in school, you would think about some medication as well, and medication along with behavioral therapy would help the child and make them progress well in school.